I am a cosmetic and general surgeon. I've been a general surgeon for many, many years. And I'm a part of the Indiana Stem Cell Treatment Center in or near Indianapolis, Indiana. It's actually located in Noblesville. We've been doing stem cell therapy or stromal vascular therapy for about 3 years. I don't think I've ever been involved in anything that's quite this exciting. I actually think, maybe I'm wrong, but I passionately think it's probably going to be the next Salk vaccine, the next penicillin, the next big major medical breakthrough. And I'm glad to be a part of the investigational research that's going on with the Cell Surgical Network. I'd like to talk to you about just 3 patients that I'm going to present at this conference that we're at this weekend. The first patient is a patient who has interstitial cystitis, which is a debilitating bladder disease. This young lady was going to the bathroom 70 times a day. She had such excruciating pain that even the activity of wearing high heels, when the heel would strike the ground, would cause her such excruciating pain she couldn't wear them. Prior to seeing me, she sent me a letter stating that if she could just hike and kayak and ride a bike and do those things that were kind of fun, it would be a miracle. Well, just prior to coming out here, she sent me some new photos. She had already sent me some photos when she was about 4 months after her surgery. She was able to ride a bike. 2 weeks later, she sent me a picture of her kicking a football. And then she just recently sent me a whole bunch of pictures, and I won't go into all of the details, doing all those things that she wrote me the letter about. But she was on her way to a 75K bike ride when I talked to her. Another patient that I'm going to talk about at this meeting is a man who could only move his thumb because of multiple sclerosis. And I've got pictures of him where he is now feeding himself with assistance. But he can lift his head, he can lift his arms, things that he could not do prior to that. And a third patient is a man who walked in like an upside-down L. He couldn't bend over and he couldn't straighten up. And we took stromal vascular fraction. Our interventional radiologist injected it into his back. And he's now 3 years out, doesn't walk with a cane anymore, and has no pain, can stand, and he can bend over and touch his toes, which he definitely could not do before. These kind of things are what makes medicine fun. And it's one of the most exciting things I've been involved in is the deployment of stromal vascular fraction with the very, very rich stem cells that we have.